So what's unique about the weight programs here at Joslin, both Y-Weight and U-Turn, is they're expressly designed to meet the unique needs of patients with type 2 diabetes who struggle with both weight and blood glucose goals. And so I think the whole treatment philosophy with our team is summed up in the acronym Y-Weight. It's not just a cute name. It actually stands for something: weight achievement and intensive treatment. And what our goal is to help patients use the medicine of weight loss to intensify their blood glucose management.
We ask people to establish specific behavioral goals.
The idea of SMART goals. The S is specific, measurable, action-oriented, realistic, and then time-limited.
We understand that each goal is going to be unique to the individual. We also understand that the first goal is a starting point, and each goal will progress after that. Logging will give you valuable insight into your unique patterns and triggers. Logging is a challenge, but if you're able to do it consistently, it's critical to your weight loss and weight maintenance success. Research shows that people who are able to lose weight and keep that weight off continue to log their food, their exercise, and their weight on a daily basis. Using the logbook helps you to recognize your patterns. Strategic eating helps you to change them for good. It's common for people to have trigger foods. The trick is to have a strategy around them rather than to rely on willpower.
There's a whole branch of psychology that looks at the influence of thought on behavior.
Everybody struggles with negative thoughts at some point.
I think people do minimize how challenging this is. And so if they hit a pitfall, they can get into this really negative, self-blaming kind of thinking.
Negative thoughts such as black and white thinking, rationalization, and not acknowledging your hard work can really get in the way of long-term success. Learning how to challenge a negative thought with logic can really help you to turn it around.
If diabetes is here to stay, which it is, and the weight struggle has been a long-standing factor, which is typically the case, then the approach needs to be here to stay. And that's what people mean when they say lifestyle. So this becomes who you are and what you do.
We think about Y-Weight as a highway. Each lane represents a different aspect of your health.
So one of the lanes is weight. You want to head to a healthier weight. One of the lanes is blood glucose. You want to head toward a healthier blood glucose. One of the lanes could be cholesterol. You want to address that and improve it.
Just because you're not seeing immediate results in all areas doesn't mean that change isn't happening.
We've all had that experience where take the wrong exit, wind up where we don't really want to go, but we don't settle in there. Like, oh, well, maybe I'll look for a house here. No, you don't stay there. That wasn't where you wanted to go. So that's the same kind of deal. When you get derailed behaviorally, you have to get back on. I think it's really important for people to understand that when their goal is to change behavior that's very, very long-standing, really habit, that the likelihood of encountering a slip or a lapse is very, very high.
Everybody has a slip now and again. It's a relapse when you go all the way back to your old behaviors. When you have a slip, use that package of strategies you've learned to respond to it and get back to where you want to be.